So when you see fatigue and fluctuations of energy, you really need to get to the bottom of it to optimize health. It is a serious issue. Now, where we are right now is now we're going to talk about the connection between fatigue, depression, and pain syndromes. So the academic objective of this presentation is to review how impaired mitochondria bioenergetics impact common chief complaints of patients. And then the clinical objective of this presentation is to understand the mechanisms of how mitochondrial bioenergetic imbalances lead to systemic pathophysiology. So we spent some time going over fatigue syndromes. We talked about all the things that impact the steps of mitochondrial homeostasis, things that negatively impact it, things that positively impact it, weighing in disruptive versus supportive mechanisms, shifting things to people to a more supportive than destructive pathway to improve energy. As those are all related to fatigue. How does that relate to pain and pain syndromes? Let me share some studies with you and show you these relationships. But to give you a clue, there's some mitochondrial involvement with these as well. So this is a paper that was titled Chronic Pain is Common in Mitochondrial Disease. So we conducted a survey of pain syndromes in patients with genetically confirmed mitochondrial disease from 2 UK mitochondrial disease specialist centers. The majority, 66.7% of patients had chronic pain, which was probably of neuropathic nature. So mitochondrial disease, the majority of patients wind up with pain. And that's that's why you see in your practice all the time. I'm so tired and this hurts all the time, whether it's headaches, whether it's injury that isn't recovering, whether the body just aches, whether they work out and just can't recover. They were all in pain. Then here's another paper that was this fibromyalgia muscle disorder. Histological studies, particularly on electron microscopy, abnormalities in the number and shape of mitochondria have been identified. So mitochondrial abnormalities, reduced capillary circulation, thickened capillary endothelium may result in decreased availability of oxygen, impaired oxygen as well as ATP synthesis. So the patients had fibromyalgia where the muscles hurt all the time. And there's always an ache there. They basically do a muscle biopsy, look at it, electron microscope and see, the mitochondria does not work. Now, when we look at a key pathway here, this is something we went over before in the neuroinflammatory course. But you have to understand that mitochondria use glucose, use oxygen. They get stimulation to support mitochondrial biogenesis to make ATP. And then inflammatory oxidative stress responses uncouple them. But if you have, let's say on the left-hand side, the ideal response where the mitochondria are getting plenty of stable, healthy glucose, oxygen, and activation, and they're able to quench their oxidative stress free radicals with antioxidants, then there's good ATP. And what happens when there's good ATP is that impacts the sodium potassium pump and resting membrane potentials to threshold. So remember, neurons are all firing at a certain degree of activity at all time. That's called the resting membrane potential. And there's an all or none phenomena where you have to have a certain amount of activity to actually reach threshold to then cause a response. And when you activate a pathway, let's talk about a pain pathway. When you activate a pain pathway, you get an influx of sodium into the cell. And you also get an influx of calcium into the cell. And that influx of sodium and calcium to the cell take that resting membrane potential to the threshold. And if it's a nociceptor pain fiber, then you feel pain. And that's a normal physiological response. Now, what happens when mitochondria are impaired, where, for example, if there's lack of oxygen from anemia or poor circulation or decreased glucose from the glycemia, or lack of activity impacting mitochondrial biogenesis, or increased inflammatory response where the mitochondria become unhealthy and there's less ATP, what happens is when that pain fiber fires, when there's just influx of sodium in, which takes the resting membrane potential to the threshold, there's not enough energy within the cell to push that sodium and calcium out. So that leads to neurons that are really close to threshold. When neurons are really close to threshold, then any trivial stimulus can then cause pain. So now you have a person who, instead of having a sharp pinprick cause pain, just touching them can cause pain. Those neurons are close to threshold. This is one aspect of several we'll talk about that leads to increased pain perception. But the basic concept is when there's mitochondrial impairment and cells do not have healthy amounts of ATP, they cannot maintain their neuron resting memory potential is close to threshold, and then any trivial type of stimulus can fire them because their distance between the rest and threshold levels are now closer together, as you can see here, compared to this. So if you look at the pain pathway, you have a needle here pricking their skin here, fires into their ascending pain pathway. It's perceived as pain. And in a situation where like everything is normal, then everything's healthy, there's a normal response that's taking place. And if we continue on here, this is what we're seeing. Neurons, resting memory potential is far away from threshold. It's normal to have pinprick, cause some sensation that's protective in a sense. It's helpful for us to move away from the injury. But when the mitochondria become impaired, then what starts to happen is the resting memory potential is really close to threshold. So there is, instead of having this normal response to activating pain pathways, neurons get close to threshold and they have significant activation of pain with trivial stimulus. And this is one of the reasons where mitochondria and pain pathways are so linked, is that these nociceptors become close to threshold. And when they study mitochondria, and it's not just sodium, but it's calcium. So calcium also gets activated into the cell. It has to be pushed out through an active transport pathway out of the cell for depolarization. And when there's not enough ATP to push that calcium out, then you can have people that have pain syndromes and pain disorders. So here's a paper that was published called Contribution of Mitochondria to Pain and Diabetic Neuropathy. In conclusion, impaired calcium homeostasis due to mitochondrial dysfunction is a factor related to diabetic neuropathy, with findings showing increased intracellular concentrations and an imbalance in calcium transport and dorsal ganglion neurons for rats and diabetic patients. This condition is associated with mitochondrial depolarization, ion pump dysfunction, and generation of reactive oxygen species. So when the mitochondria are unhealthy in neurons, they can't push sodium and calcium out. So there's constant pain activation, constant pain sensitization, sensitivity to pain. And this is part of the reason why when mitochondria start to fail, people start to develop pain syndromes and chronic pain all the time and everything hurts. Now, here's a paper that was published titled Endoplasma Reticulum Mitochondria Interplay Chronic Pain and the Calcium Connection. They go on to show that emerging research also suggests that chronic pain associated with inflammatory diseases such as MS and rheumatoid arthritis may be linked to endoplasmic reticulum mitochondrial dysfunction. In all these pathologies, it is clear that pain is a major overlapping symptom. A common thread linking pain to these conditions is stress at the endoplasmic reticulum, ensuing mitochondrial dysfunction and calcium dyshomeostasis. A better understanding how disrupted endoplasmic reticulum mitochondrial interactions can lead to nociception. Better understanding of how disrupted ER mitochondrial interactions can lead to nociceptor hyperexcitability may provide insights into novel therapeutic targets that can be manipulated to reverse the changes that have been sensitized to the system and restore homeostatic state. So it's the same thing. It's very clear that calcium dyshomeostasis, the inability to push calcium and sodium out of a depolarized cell because of lack of energy from mitochondrial impairment, can lead to chronic pain and chronic pain syndromes. And then here you can see when these neurons are constantly activated over a period of time. So you have neurons close to the threshold constantly activating pain pathways, and you have inflammatory responses, that you start to develop central sensitization, meaning if you activate a pathway over and over again, it gets more efficient. So if you're trying to learn how to dance and you twirl around, maybe the first twirl you do, you're all over the place and falling over. But if you do 1,000 twirls, you get it smoother and smoother and smoother. And eventually it's just very easy for you because those pathways become connected. If they were to actually measure the neuron connectivity of the pathways involved with you twirling around and spinning, they would have more connections and more connectivity there. That's the concept of neuroplasticity. Neuroplasticity can also be negative, and that's termed negative plasticity. When activating a pathway over and over again gets more efficient, but it causes an adverse symptom. So you can have pain develop to neuroplasticity that then leads to efficiency of that system. So if you constantly fire your pain pathway over a period of time, these pathways for pain perception get to become more exaggerated, more efficient over time. So as neurons get close to threshold, neurons are constantly firing more, and then their postsynaptic pathways cascade activation, and now you get central sensitization, where this neuroplasticity, development, and connectivity of those brain pathways continue to get more efficient, causing greater pain and greater degrees of suffering, nociception perception with people that are dealing with mitochondrial impairments. This is a paper titled Chronic Pain, the Role of Learning in Brain Plasticity. They go on to show that based on theoretical considerations and recent observations, we argue that continued suffering of chronic pain is clearly dependent on the state of motivation and emotional mesolimbic prefrontal circuitry in the brain. The plastic changes that occur within the circuitry in relation to nociceptive inputs dictate the transition to chronic pain, rendering the pain less somatic and more affective in nature, meaning the brain is now sensing pain because it's more efficient, even though there isn't as much tissue distortion. That's plasticity, negative plasticity. So the brain changes. I'm going to show you a lot of cool research tomorrow on central plasticity, what happens to the brain. There's definitely changes in the brain immediately with pain. And then if that pain is continued on, the brain can continue to develop this negative plasticity response. And then a person no longer has to have an injury to constantly feel pain. And the start of all this, mitochondrial impairment. So as energy levels drop, these mechanisms get into place. Now you're dealing with chronic pain syndromes. So when someone says to you, low energy, I have low energy, one of the consequences of that is they can start to develop a pain syndrome when they get injured. And this is not a good thing to develop. Okay. Now, in this paper that's also in your course materials, they just show these pathways, nociception coming in, these green arrows here, really developing plasticity in these areas of the prefrontal cortex and then the limbic system. And this is all associated with emotional suffering of pain. So these just become very efficient over time. And then in this paper titled Understanding the Role of Mitochondria and the Pathogenesis of Chronic Pain, they go on to show that mitochondrial dysfunction contributes to the etiology of pain. And it suggests that mitochondrial energy generating systems and mitochondrial reactive oxygen species play the most important roles in the pathogenesis of chronic pain. Protecting mitochondrial function would be a promising therapeutic strategy to alleviate or prevent chronic pain states. So listen, if you're a practitioner and you have chronic pain patients, whether it's my fibromyalgia patients or ACFS patients or patients with chronic pain with unknown etiology, you're going to have very limited effect with any intervention unless their mitochondria become healthy. All the strategies we talked about getting mitochondria healthy could be huge. You could have someone who has neuropathic pain. Let's say they had a crushed nerve injury in their hand from occupation, or they had a herniated disc and injured their, L5 nerve root. Now the disc is healed. There's no more pressure on the nerve. Now the crushed injury is gone, but they constantly have burning and pain. They can't function. You may go in there and switch them into ketogenic diet, get fuel to their system, put them on nutraceutical support to bioenergetics, get them to sleep properly, get them to have a normal circadian rhythm, and you may cut down their pain dramatically from those interventions because you're improving their mitochondrial function. So that's the implementation of this information. It's not just about energy, it's also about pain. So even if you're dealing with really severe chronic pain patients, you have to know the only way out for these patients is by improving their vicious cycle of low energy. And this is a paper titled Metabolic Connections of Inflammatory Pain, Pivotal Role of Pyruvate Dehydrogenase Kinase Lactic Acid Acidosis. And they basically show that for some people that have these inefficiency of producing pyruvate into lactate, like we talked about, this Warburg effect, they have increased lactate, increased activation of inflammatory pathways from lactic acid. This causes pain sensitization. Then they get negative plasticity. Their pathways to their spinal cord and spinal cord become much more efficient generating pain. Then these create pain in the brain. And then you have brain plasticity there. And this is basically fibromyalgia right here. Fibromyalgia, inefficient muscle metabolism, nociception pathways, and then centralization of pain. This is a very clear mechanism that has been established. Now, in this paper, they go in there and they look at glial cells and how they react, and they use the dichloroacetate, which is one of the supplements you can use for pain, for the Warburg effect. And they go on, and our work reveals changes in spinal cord mitochondrial function in persistent inflammatory and chronic neuropathic pain models. We also demonstrate that by targeting PDK, PHC acts with short-term oral dichloroacetate administration after injury, mitochondrial bioenergetic parameters improve, glial reactivity spinal cord is reduced, and most importantly, it can be effective in ameliorating pain-related behavior in both pain models. So they basically went in there and shifted the Warburg effect to reduce pain. Very important. And then here's another study where they look at neuropathic pain, and they go on to show that neuropathic pain affects the physical and mental health status of patients due to its complex pathogenesis and adverse reactions to medicines. Its treatment remains challenging. Among all the etiologies, increasing evidence is pointed to mitochondrial dysfunction. They go on to show that DRP1 mediated mitochondrial fragmentation leads to excess reactive oxygen species, which implicate the pathogenesis of neuropathic pain. So if they can't activate clearing of these mitochondrial fragments, fission, then that increases pain. And how do you get rid of mitochondria that's fragmented? Mitophagy. How do you get rid of that? You sleep. You get into deep REM sleep. So you can activate those metabolic pathways. So, these are showing that when this fission pathway is not working well, they can't get rid of these fragmented pathways. These fragmented pathways lead to mitochondrial dysfunctions. They take up that real estate where healthy mitochondria can go, and this perpetuates the chronic pain pathway. Now, this was a review paper called Neuropathic Pain Dysfunction of DRP1 Mitochondrial and RLS Homeostasis. And one of the things that they go into and discuss here are mechanisms that really impact preserving mitochondrial health to alleviate hyperalgesia. First of all, there's some medications that impact these DRP1 pathways, inhibitors. They found that those things may have an effect. But they have found, number 4, modulate calcium efficiency for mitochondrial function has a direct impact on impacting vision. And melatonin also, remember, helps with the Warburg effect, and that can increase mitochondrial function, reduce pain. Hyperbaric oxygen improves blood flow and mitochondrial function. They also found ketone bodies reverses abnormal mitochondrial morphology. So fuel to the mitochondria actually changes mitochondrial integration and reduces pain. So not only that there's links with mitochondrial imbalances causing chronic pain, but when they do interventions to improve mitochondria function, it does change pain. So this is one of the things you have to look at. See, the problem is most healthcare practitioners, they see a patient chronic pain and they go, they need anti-inflammatories. Let's get them on NSAIDs or acetaminophen or aspirin or Tylenol or opioids. Opioids actually sensitize pain pathways to make people worse. Opioids promote negative plasticity. They actually make all chronic pain symptoms worse, established in the literature. It's a failing model. And then if people that do nutrition, they go, anti-inflammatories, we'll just use turmeric, we'll just use curcumin. And those things are okay, and they have some benefits, but it's really changing mitochondrial homeostasis that gets rid of chronic pain. That's why getting into deep REM sleep, having circadian rhythms, having proper fuel energy sources, having proper oxygen, making sure you don't have any asthma or respiratory issues, make sure they're not anemic. Those are the things that actually change chronic pain patients. And it's not inflammatory necessarily. It's just energy.
If you're a licensed healthcare practitioner ready to evolve your functional medicine practice, explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.